Professor Sharfstein, what has changed is the bet or the game of correlation of cases to deaths. Are the correlations of cases towards deaths the same for, say, Florida as they were for New York and New Jersey months and months ago?
And not at that point, and certainly not at this point. And there are a couple of reasons why that may be the case. We're now seeing deaths trend upward, so it could be primarily a function of timing, that there were younger people infected in the South, but now they're starting to infect people who are at greater risk for death, like older adults. But it also could be that the treatment is getting better, which would be a good thing.
Right.
Certainly, we have a couple drugs that may work well, and but even if they reduce mortality some, it's still a lot of people dying.
And what's so important to me and what I think our audience wants to know is away from death, there's a lot of injury, isn't there? What have you learned about the substantial harm to the body one can get even if they don't die?
Yeah, I mean, I put those into two categories. There's the harms to the lungs, so people who have a serious pneumonia or have to be ventilated or are in the intensive care unit. It can take them quite a while, and we don't know yet whether they will really regain their full lung capacity and be able to exercise the same as they did before, or some, cases really get around like they did before. And then there are the complications that are outside the lungs, strokes, other kinds of clotting disorders in different parts of the body. So, it's early to really understand the full problem. And of course, we also have the mental health complications of having been very sick and, fearful for your life and going through all this, which are going to haunt a lot of people.
We celebrate, Professor, in New York, no deaths. I believe that occurred yesterday. We had 0 deaths for the first time in 100+ days. Does that mean we can let our guard down? Does that mean we can dash off to the restaurants for lunch today?
Well, certainly it does not mean that. But I do think what it does say is that we are not inevitably stuck with the tremendous spread of the virus. It's up to us. New Yorkers hunkered down for quite a while. People have been very worried, and so they've stayed vigilant in New York, and that has allowed the cases to come down. That path is available to every other part of the country if they choose to take it. And of course, like you said, once they take it, you really need to stick with it until we get a vaccine. Many countries around the world have been able to do that successfully.
Professor, would you eat in a restaurant indoors right now?
I would say probably not. I think I would, though, consider outdoor seating. In fact, I did do that once. So, but I have not eaten indoors.
So so what I'm really fascinated by at the moment, clearly the Sun Belt's pretty hot down there at the moment. People are going inside for the AC. That does seem to be a significant source of transmission. In the Northeast in the United States and here in Europe, at the moment it's summer, we can all go and sit outside. Nice to eat al fresco. But come October, November, December, how are we going to transfer that inside? How do we make that happen? Or do you think it will be impossible?
Well, I think it's very important for employers that can keep people at home to keep people at home. We have to thin out the workplace as much as possible. I think we're going to have to be very vigilant. Hopefully, we can build up a more intense public health response. I don't necessarily think that indoor restaurants are bad for everybody. If you keep the numbers low and you separate people, the risk is pretty low. Maybe it's a little high for me, but it's still pretty low. And it also depends on how much is out there in the community. So I think you have to kind of take it one step at a time. But if we have more of a public health response and we're vigilant, we can do testing well, then, you can manage that. There are places around the world that are opening restaurants again because they've been able to have a strong response.
You talk about testing, you talk about managing the virus. Do we have a handle on what the level of asymptomatic incidence of the virus is? And does that number go higher as we get into a younger demographic?
I think generally speaking, it appears that at least about half of the infections, people don't develop symptoms. And it does appear to be more likely, I think, when they're younger people who are getting sick. So, that has obviously made things complicated. It doesn't prevent you, though, from having a strong public health response, because if you track the cases and their contacts, you can get to people who may never develop symptoms, but you can keep them from going out by asking them to stay at home. And so there are ways to reduce the spread, even if there are people who won't get symptoms. And that's why this approach has worked in other countries. It's just an extra reason, though, for people to wear masks and to take all kinds of precautions.